are cared for, where economically challenged families know their children can be fed, where our communities can find common ground cheering at sporting events, and where America's future is being formed by the knowledge and values we impart to the next generation. Schools are currently struggling to safely reopen because of this president's failed response to the pandemic. There is still no testing and contact tracing strategy or science-based plan that we know other countries are using successfully to combat COVID-19. Now, the daily number of new cases in the United States is exceeding 60,000. 60,000, much higher than when the pandemic first caused schools to close nationwide in March. The Centers for Disease Control and Prevention has made clear that fully reopening schools carries the highest risk of creating new spikes in COVID-19 infections. We had hoped to have CDC here today to discuss what best practices could help safely reopen America's schools, but the White House refused to let its officials testify at today's hearing. While initial studies suggest that students are less likely to contract COVID-19 and suffer serious illness, across the country, outbreaks at summer camps and even among infants make clear that we do not know enough about the risk for children. And a Kaiser Family Foundation analysis estimates that 1.5 million teachers, nearly 1 in 4, have health conditions that put them at higher risk of serious illness if they contract COVID-19. This risk can be mitigated and tragedies can be prevented, but it requires both a nationwide strategy to contain the spread of the virus and a significant federal investment to help schools to take necessary safety precautions. House Democrats have not been idle, waiting for a miraculous disappearance of COVID-19. The CARES Act in March provided over $13 billion directly to schools to help deal with the cost of closure and transition to an online learning environment. In May, the House passed the HEROES Act with another $60 billion in emergency school funding to help schools buy personal protective equipment, sanitize classrooms, and make special arrangements for students and teachers in high-risk categories so schools can safely reopen. And this month, this committee's Reopen and Review America Schools Act was included when the House passed the Moving Forward Act, another investment of $130 billion that can be used to reconfigure and modernize schools to protect the health of students and staff. Unfortunately, our Republican friends in the Senate have chosen, like the President, to hide from the problem and taken no action on the House proposals to help America's schools safely reopen. We're hearing this week the Senate may finally be waking up to the enormity of the problem. I hope they shake themselves awake because time is not on our side. For many, the school year should begin next month, but you cannot modernize the HVAC system in a 40-year-old school on a moment's notice. According to the Superintendents Association, the average district will need $1.8 million of work before schools can safely reopen. The House voted to give them the money to get started months ago. The Senate slept. Meanwhile, instead of joining Democrats to deliver more funding to help schools reopen safely, Secretary DeVos and President Trump are threatening to strip funding from public schools that determine they cannot safely bring all students back into the classroom full time. They have it backwards. As a national survey published on Monday found, 86% of America's school principals said it is extremely important, that's in quotes, extremely important to get additional funding so their schools can safely reopen. And that's just the opposite of the administration's threat to defund schools. And to be clear, the President has no legal authority to withhold school funds that Congress appropriated. But I should also note that my Republican colleagues, who have consistently railed against the federal government's role in education, now believe that the Trump administration should act as a national school board that coerces schools into opening for full-time instruction regardless of local health conditions. Meanwhile, the Education Department has no plan, no plan at all for transitioning students back to in-person instruction safely. Instead, it is blaming teachers and administrators for not doing enough. So we'll be listening today to national leaders and experts who want to make sure Congress provides meaningful assistance to America's schools. I thank our witnesses in advance for their advice. And I now yield to Mr. Allen for the purpose of an opening statement.
Thank you, Mr. Chairman. Reopening American schools has dominated family conversations around the country the last few weeks. The good news is science is on our side, and federal agencies like the Centers for Disease Control and Prevention and state agencies like the Georgia Department of Public Health have provided detailed reports on how we can reopen schools safely. I hope during today's hearing we can put political finger-pointing aside and put our children's interests first while we discuss not if, but how we can safely reopen schools this fall. I know both my Democratic and Republican colleagues agree that students are being harmed by the physical closure of schools and that we need to provide the option of in-person instruction. As we gear up for a new school year this fall, the question of how to reopen our nation's schools safely needs to be a top priority for this committee. This past spring, more than 55 million students were affected by COVID-19 related school closures. That number accounts for approximately 97% of students nationwide. The result? Well, the numbers speak for themselves. The Collaborative for Student Growth projected that some students could experience as much as a 50% reduction in typical learning gains as a result of school closures. Another analysis conducted by McKinsey & Company, a consulting group, found that when all the impacts of COVID-19 are taken into account, the average student could fall 7 months behind academically. As Leader McCarthy argued, we cannot afford to let a generation miss out on being taught. President Trump also recognizes the vital importance of safely reopening America's schools. Sadly, learning loss isn't the only challenge students face due to school closures. This pandemic and subsequent school closures have dramatically reduced interactions between vulnerable children and trusted adults while exacerbating conditions that contribute to child abuse and neglect, such as financial strain and social isolation. School closures diminish educators' ability to serve these vulnerable students. Additionally, for some children, school is the only place where they receive nutritious meals on a consistent basis. According to the Department of Agriculture, more than 30 million children in the U.S. count on schools for free or low-cost meals. So when schools and child care centers close, children miss out on essential food services. Let's not forget the economic downside of keeping schools closed. If children can't attend school, parents can't return to work. In fact, the Brookings Institution argues the world could lose as much as $10 trillion over the coming generation as a result of school closures today. School closures also disproportionately impact the economic well-being of lower-income and single-parent households. While families with multiple workers may be able to have one working adult scale back in their hours or quit their job to take on caregiving duties full-time, this is unlikely to be feasible for all families, especially those already struggling financially during this economic downturn. In May, the CDC released guidance on reopening schools that includes ways in which schools can help protect students, teachers, administrators, and staff. These guidelines recognize that each school is unique and there will be no one-size-fits-all solution to reopening. Given that schools vary in their location, size, structure, the CDC recommends that school officials should determine in collaboration with state and local health officials whether and how to implement CDC guidance. Moreover, the American Academy of Pediatrics also released guidance for schools. They strongly advocated that all policy considerations for the coming school year should start with a goal of having students physically present in school. What do educators think? The American Federation of Teachers found that 76% of educators surveyed would be comfortable returning if certain health and safety conditions were met at their school. This includes daily cleaning and sanitizing of school facilities, additional protections for at-risk students and staff, and availability of protective equipment. These are steps we can and should take to safely reopen our schools. That is why this morning I introduced the Educational Flexibility for Families Act, legislation that requires K-12 schools to provide an option for students to safely attend in-person classes for the upcoming school year in order to be eligible for any federal assistance. My bill would ensure that the option for in-person learning is on the table and available for families around the country who want their children to safely return to the classroom this fall. I am proud of the educational leaders in my district who are committed to providing families the flexibility that they need this school year, whether it's in the classroom, distance learning, homeschooling, or a hybrid model. The bottom line is schools must be prepared to provide every student effective instruction this fall and customized to that student. The health and future of our nation's students depend on it. I thank our witnesses for testifying on this important topic today, and I look forward to hearing from them about the measures we can take to safely reopen Americans' classrooms this fall, and I yield back.
Thank you, Ranking Member Allen, for that opening statement. All other members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on Thursday, August 6, 2020. I will now introduce our witnesses. First is Dr. Michael Hinojosa, Superintendent of Dallas Independent School District. Mr. Hinojosa has served as Dallas ISD Superintendent since 2015. He served 20 years as a superintendent, CEO of six public education systems, including 2 of the 25 largest school systems in America. He is past president of the Texas Association of School Administrators. He's a proud graduate of Dallas Independent School District and holds a doctorate in education from the University of Texas in Austin. Next is Ms. Leslie Boggs, president of the National PTA. Leslie Boggs is the 56th president of National PTA, the nation's oldest and largest volunteer child advocacy association. A leadership development expert from Odessa, Texas, Boggs has over 20 years of leadership experience at all levels of PTA. At the state level, Ms. Boggs serves as president of Texas PTA and New Mexico PTA. A mother of 3 and a grandmother of 4, Boggs is a dedicated and passionate advocate for children and their right to receiving a quality public education, no matter their demographics, ethnicity, or household income. Next is Dr. Penny Schwinn, joining us here in the committee room, Commissioner of Education for the state of Tennessee. Dr. Schwinn comes from a family of educators and is committed to increasing access to an excellent education for all children. She began her work as a high school history and economics teacher in Baltimore. Dr. Schwinn was sworn in as Tennessee's Education Commissioner on February 1, 2019. And prior to joining the Tennessee Department of Education, Commissioner Schwinn served as the Chief Deputy Commissioner of Academics at the Texas Education Agency. Commissioner Schwinn earned her Bachelor of Arts from the University of California, Berkeley, her Master's of Arts in Teachings from Johns Hopkins University, and her PhD in Education Policy from Claremont Graduate University in California. Last is Dr. Sean O'Leary, MD, Professor of Pediatrics, Infectious Diseases, University of Colorado. Dr. O'Leary is a professor of pediatrics at the University of Colorado School of Medicine and Children's Hospital, Colorado, a pediatric infectious disease specialist, and the director of the Colorado Children's Outcomes Network. He is an accomplished researcher with over 120 peer-reviewed publications. His research focuses on vaccine-preventable diseases. Dr. O'Leary is a member of the American Academy of Pediatrics Council on School Health and serves as the vice chairman of the Committee on Infectious Diseases for the AAP. He also serves as the liaison to the CDC's Advisory Committee on Immunization Practices for the Pediatric Infectious Disease Society. Dr. O'Leary co-authored the AAP's Guidance for School Reentry. We appreciate the witnesses for participating today and look forward to your testimony. Let me remind the witnesses that we have read your written statements and they will appear in full in the hearing record. Pursuant to Committee Rule 7D and committee practice, each of you is asked to limit your oral presentation to a 5-minute summary of your written statement. And let me remind the witnesses that pursuant to Title 18 of the U.S. Code, Section 1001, it is illegal to knowingly and willfully falsify any statement, representation, writing document, or material fact presented to Congress, or otherwise conceal or cover up a material fact. During your testimony, staff will be keeping track of time and will use a chime to signal when 1 minute is left and when time is up entirely. They will sound a short chime when there's 1 minute left and a longer chime when time is up. Please be attentive to the time and wrap up when your time is over and remute your system. For the witnesses participating remotely, if any of you experience technical difficulties during your testimony or later in the hearing, you should stay connected on the platform. Make sure you are muted with the mute button highlighted in red and use your phone to immediately call the committee's IT director, Sheila Havener, whose number has been provided. We will let all the witnesses make their presentations before we move to members' questions. When answering a question, please remember to unmute your system. And I will first recognize Dr. Hinojosa. Sir, you have 5 minutes.
Thank you, Mr. Chairman, members of the committee. I do appreciate this opportunity to testify in front of you this morning. My name is Michael Hinojosa, and I'm the superintendent of the Dallas Independent School District. I'm also here representing AASA, the Superintendents Association, as I'm a member of the COVID-19 Recovery Task Force, and it's an honor, as I said, to be in front of you today. The Dallas ISD has 153,000 students, and right now we're preparing to launch the school year, and we face many challenges. When we shut down right before spring break, we decided to offer some opportunities for learning at home. We have a master plan to deploy devices to all of our students, but we had to accelerate that plan. And then we ran into some other issues about connectivity once the devices got in the hands of our students and families. So we figured out that we tried to train teachers and get everyone prepared almost on a moment's notice, but learned that we would have some significant long-term issues on how we respond to those matters. When we started this journey back in March, Dallas County only had a total of 1,300 cases, confirmed cases in the county. In the month of July, we have had 14 consecutive days where we had over 1,000 cases per day. So the context has been changing significantly as we've moved forward. We are now learning that our best option may be to do distance learning. We certainly want to see our students. We haven't seen our students since March, and we know that we need to see our students, but things are evolving. And in fact, tonight, I'm meeting with my school board to present our latest option about adjusting our calendar so that we can offer both remote and on-campus instruction. But how we actually do that, we need to buy some time with our school board. Recently, also, the state of Texas has pivoted a little bit. Initially, they said we would have to have in-person instruction before we would qualify for any funding. Now they have given us more leeway. They've now given us a 4-week window where we could have virtual instruction before we have to do in-person instruction and still be able to qualify for state funding for our public education. The COVID cases had been 1,000 a day for this month. However, we have some recent good news because we've been asked to really wear masks and social distance. The last 2 days have gotten a lot better in Dallas County. We went from over 1,000 to 700 to 400. The bad news is the deaths have increased significantly in the county. So there is this lag effect, and that's precisely why we're asking for more time for our families. In addition, it's also very important for you to know that 91% of our families are ethnic minority, Black and Latino families. And so these are the two largest groups that are negatively affected by the crisis. When we started this journey, we surveyed our parents. Early on, 30% of our parents said they wanted an at-home learning option, and 70% said they wanted to come in person. As the crisis got worse, we are now at a 50-50 split. And now we feel that if we did a survey today, it'd be more than 50% of our parents that would ask for an opportunity for virtual instruction. And then the next matter that we is also changing. Early on, when we asked our teachers how many were ready to come back, ready, willing, and able, 91% of our teachers said they were ready, willing, and able to come back. As we've talked to our teacher organizations and we're doing a new survey, that has completely changed. We're probably at 50-50, maybe even less than that, as we try to communicate with our teachers. We have a lot of employees that signed up to speak to our school board this evening as a result of the changing paradigm in Texas. I know that my time is running short, but I also want to say that broadband connectivity is a huge issue for us. If we actually have to shut down, it's going to be very imperative for us to have an opportunity to continue learning at home. There are several bills in front of Congress that would make this a reality for us to knock down the front door to be able to have high quality broadband connectivity for all of our families, not only for education, but also to have telemedicine and also the ability to apply for a job. We're fortunate right now that we have some funds in reserve, but that's not true for most school districts. And the number of bills that are in front of Congress, we know that Congress had to help large business, small business, and even individual families, but now state and local governments need that support as well, including firefighters and our teachers, to make sure that we have an opportunity to be successful in the future years. Thank you very much, and I will cede my time. Thank you.
Thank you, Dr. Hinojosa. You see how 5 minutes goes by so fast, but thank you. I now recognize Ms. Box. Ms. Box, you have 5 minutes, please. Thank you.
Chairman Sablon, Ranking Member Allen, and member of the subcommittee, thank you so much for this opportunity to testify today on what is needed to support the safe reopening of our nation's public schools in the midst of this pandemic. I am here today on behalf of National PTA, the nation's oldest and largest child advocacy association, with Congresses in all 50 states, the Virgin Islands, Puerto Rico, and DC. Since 1897, National PTA has been a strong advocate and the resource for millions of parents, teachers, grandparents, families, and community members who share a commitment to improving the education and health and safety for all children. We speak with one voice for every child. As the president of National PTA, I have seen firsthand how the partnership between parents and school leaders is now more important than ever. Unfortunately, this pandemic is far from over, and we cannot downplay the critical nature of this virus. We are seeing a substantial increase in cases across the country, including in my own home state of Texas. Children are the future of our nation, and we must keep them safe. Claims that all children are asymptomatic and can't spread virus are simply not true. Our utmost priority during this time continues to be the health and safety of all students, their families, educators, and school personnel. States and school districts or the federal government should not simply hoist plans for reopening schools on parents. State and school district leaders must meaningfully engage with parents and stakeholders on developing plans to reopen schools, and subsequently throughout the year as changes occur in plans and strategies to ensure both learning and safety. Parents know the value of in-person instructions and want their children to be back in school this year. However, this must be done safely and effectively and with engagement of all stakeholders, especially parents and students. Our association understands that the reopening of our nation's schools during this crisis is vital to ensure the continuity of education. However, it should not outweigh the safety and the mental and physical health of our students, educators, staff, and families. Our nation's parents and educators have significant concerns. In fact, we recently surveyed parents and other stakeholders during an online forum last week, and 72% were not confident that schools could physically reopen in a safe manner. Regardless of each approach to beginning the school year, safely and effectively reopening schools is going to take resources. Whether schools begin the year in person, remotely, or a hybrid combination, funding our nation's public schools should not be political. It is an investment in our nation's future success. Schools must be prepared to address the transition back to school, the trauma of a pandemic, and the many instructional issues, including the effects of learning loss and the digital divide. The added strain of recovery from a worldwide pandemic will wreak havoc on all localities and will require significant, immediate, and continuing support and resources from federal and state governments. National PTA is encouraged by and thankful for the adoption of previous COVID-19 packages. However, despite these actions, there are and will be continued needs Congress must address. National PTA has been advocating for many weeks for additional aid for our public schools in response to this virus. Before I reiterate our previous recommendations, I want to reinforce our opposition to any private school voucher programs or other mechanisms to funnel public dollars to private schools. Our public schools must be fully funded. Our larger recommendations call for action in 5 areas. Building off the Education Stabilization Fund, the 4th emergency COVID response bill must be provided at least $175 billion in emergency funding directly to states to support K-12 education. Next, we are recognizing the devastation of facing state and local economies. It is clear that when schools open their doors, their student population will be significantly needier. We've urged Congress to provide $13 billion for the IDEA and $12 billion for Title I, in addition to funding provided throughout the fiscal year 2021. Next, outside of and in addition to the Fiscal Stabilization Fund, Congress must include $4 billion in funding for remote learning through the E-rate program. Next is a provision for a one-time infusion of $245 million for the statewide family engagement centers to enable them to support the needs of families, children, and educators during this crisis. And last but not least is the increased funding for food and nutrition services at USDA to prevent and prepare for food insecurities, to help schools adapt to food service and meal protocols as students physically go back to school. National PTA does urge the Congress to act swiftly.
All right, Ms. Box. Now, thank you very much for your statement. And I now would like to recognize Dr. Swin, who did not take a flight from Baltimore to join us here in the committee room this morning. Dr. Swin, you have 5 minutes, please.
Good morning, Chairman Sablon, Ranking Member Allen, and members of the subcommittee. Thank you for inviting me today. I very much appreciate the opportunity to share Tennessee's story and the incredible work that continues to be done by our districts, educators, and Department of Education on behalf of students. I also want to thank Governor Bill Lee and the Tennessee General Assembly for their unwavering support in prioritizing education. I am proud that Tennessee has committed to maintaining the same level of state funding to our districts as in previous years, demonstrating the state's clear and continued commitment to schools. However, we also know that this is not like other years. We know that this school year will look and feel different. Districts are trying to make decisions with constantly updated information and the lives and livelihoods of children and staff to consider. This is a serious discussion that is worthy of a greater understanding of the complexities that exist for schools, staff, and families. At the core, our systems have the monumental task of keeping people safe and healthy so that we can provide children with a strong education. In Tennessee, most districts are choosing to include both an in-person and a remote option and are focusing on how to do that safely. These are unimaginably hard, taxing, and critical decisions, And as we prepare for school reopening, there are 3 primary areas that must be addressed: the health and safety in schools, technology, and child well-being. First, to safely reopen schools, we must put the health of our students and staff front of mind. Under Governor Lee's leadership, the Department of Education has partnered closely with other agencies to address the needs of the pandemic. The cross-agency partnership has led to a number of significant resources for our schools, including PPE for every staff member, disinfecting kits for classrooms, and resources co-developed with the Department of Health. To reopen, we must provide these types of assurances and deliver. Second, we must address the opportunity and access gaps in technology and broadband that exist for our students and their teachers. Governor Lee recently announced $50 million in technology grants for our districts, which will support purchasing 1 computer for 1/3 of all students in Tennessee in grades 3 through 12. This investment in devices allows for continuity of instruction when remote learning is required. However, it is also a critical investment in our education system that is necessary now and will continue to pay dividends in the future. Finally, school reopening must consider child well-being regardless of the format of instruction being provided so that every child has his or her needs met and services provided. When schools are closed, those services become more challenging to deliver and can impact a child's ongoing development. The department created a robust child well-being task force to focus on the needs of students as they return to school. This has been done alongside significant academic resources, free professional development for teachers and principals, and grants to expand opportunities for both children and school staff to address the learning loss and child well-being needs that resulted from school closures. In closing, we must continue to ask ourselves, what is in the best interest of students and staff as we balance the needs of community health, access to strong educational opportunities, financial stability for families, and critical services to students? Education is personal to everyone. We aren't just talking about an abstract idea. We are talking about children, my girls, the students I serve in Tennessee, our children. It's nothing if it is not personal, which is why we must treat it as such and not as an either-or conversation. Families must make their own choices, and districts must ensure that they are considering the feasibility of providing those choices. If schools are going to be open, it must be done safely and with sufficient health protocols and supplies in place. It must also allow the flexibilities necessary to protect vulnerable staff and students. If schools are going to be closed, then we will need to have clear plans on how we will support working families who may not have an option to work from home, how to provide food to students just as they would receive at school, how to provide the required special education, language, counseling, and health services necessary for students to continue to learn and grow, how to remotely teach children to read, how to address the increasing and unreported cases of abuse and suicide that have been noted, and how to do all of this while still ensuring children continue to be educated. Any option we choose has consequences, which is why options are so important. It is also why federal funding will continue to help our schools to create those options with the resources necessary to do so safely and responsibly for all. But there is a clock. Schools are starting. This is one of those moments for our field and our country. Our kids deserve our best right now, and nothing less is acceptable. Thank you.
Thank you, Dr. Swindon. Thank you for ignoring the clock at least at this morning's hearing. I'd now like to, I recognize Dr. O'Leary for 5 minutes, please.
Chairman Sablon and Ranking Member Allen, thank you for the opportunity to testify for you today. My name is Sean O'Leary, and I'm a practicing infectious disease pediatrician from Denver, Colorado. As a parent of 2 children in public schools, this issue is both professional and personal for me. I work at Children's Hospital Colorado, and I'm testifying today on behalf of the American Academy of Pediatrics. As the Vice Chair of the Committee on Infectious Diseases, I'm part of the team that authored AAP's guidance on school reentry. The purpose of the Academy's guidance is to inform school reentry policies that foster the overall health of children and adolescents while also protecting teachers, staff, and communities. Our guidance is based on the best currently available evidence and is updated as new evidence comes to light and we learn more about COVID-19. We start from the knowledge that children get much more than an education at school. In addition to math, reading, and science, schools help students develop important social and emotional skills, offer healthy meals, and provide physical activity, among many other benefits. Lengthy time away from school deprives students of these benefits and makes it difficult for schools to identify and address learning deficits, child abuse, substance use, depression, and suicidal ideation. Any parent of school-aged children can tell you the difficulties we faced when schools shut down in the spring. My own children missed their friends, and they also missed out on learning and physical activity. As working parents, we struggled to find ways to meet their needs and perform our jobs at the same time. The importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures. The impact has been particularly hard on minority children, as well as children who are medically fragile, have developmental or physical disabilities, and those living at or near poverty. AAP carefully weighed the available evidence and determined that our overall goal should be to have students physically present in school this fall. However, this can only happen with careful measures to keep students, teachers, and staff safe, and with flexibility to adapt as needed to the community's prevalence of COVID-19. This does not mean that we recommend that all schools open 5 days a week from the start of the school year. Many parts of the country are currently experiencing uncontrolled those areas to maintain in-person learning, as we recognize that many jurisdictions will need to utilize distance learning strategies. And our guidance is based on particularly young resulting from SARS-CoV-2. A study that showed that children under age 10 were roughly to spread. The same study also suggested that adolescents and teens aged 18 may spread the virus at rates. In mind, school systems may consider prioritizing and taking additional measures of face coverings for older children. It also COVID-19 policies are intended to mitigate, not eliminate risk. While no single action will completely eliminate the risk of infection, implementation of several coordinated interventions that risk. Schools will need to follow guidance from public health officials, adhere to health monitoring and cleaning protocols, utilize face coverings as much as possible, and urge frequent hand washing. Schools will also need to have sufficient teachers and staff, implement new procedures for busing, and put protocols in place for how to teacher tests positive. Also important that children are up to date on all influenza vaccine. Schools must also needs of children and staff when schools reopen. The emotional impact of the pandemic, financial concerns, and social demands careful attention and planning. In order for schools to be able to with students, schools adapt and make necessary changes in accommodations. Specifically, the AAP urges Congress to provide at least $200 billion in help schools reopen. Money must be available regardless of their timeline for reopening. Rates of COVID-19 spread may need to consider delaying a return to full. Schools will need the same or greater federal investments, not less. In closing, reopening safety, learning, and the well-being of children and communities will clearly require substantial. Thank you for the opportunity to testify today, Chairman.
Well, thank you, Dr. Thank you, and thank you for their statements. Under committee Rule 8A, we will now question witnesses under the 5-minute rule. I will be recognizing subcommittee members in seniority order. And again, in order to ensure that the members' 5-minute rule is adhered to, staff will be keeping track of time and will use a chime signal when 1 minute is left and when time is up entirely. They will sound a short chime when there is 1 minute left and a longer chime when time is up. You can't miss the chime, the longer time. So please be attentive to the time and wrap up when your time is over. During the hearing, you should stay connected. You're muted with the mute button red and use your phone to the committee's IT director, Sheila Havener, whose number has been provided. And I recognize myself for 5 minutes. I have my first question. President of P. How many schools plan to implement rotating schedules where students will rotate daily, weekly, monthly, or on a quarterly basis? Public schools plan a staggered schedule under a partial reopening scenario. So how have families reacted to the idea of rotating school schedules? Plans of parents on rotating schedules when they have children across different grade levels can be or on families who have multiple children in schools across different grade levels.
As I visited with all of the state presidents, it was evident that every school is implementing a plan, and it should be locally based about the needs within the community. So there's no one way for everyone to do it the same. I think it's important that the school districts have those conversations with their parents and their students and their educators to find the best plan, whether that should be in person, remotely, or a hybrid. I think it's going to change. Even as you heard Dr. Henanov, in Texas, we're changing with it weekly in our state. I think that's what you're going to see for all others. How do parents feel about that? Well, they're concerned, as you noticed in the survey that we took last week when we had an online forum with infectious disease doctors. 72% of the parents were not sure about the safety of schools. So it's important when we talk about funding that everyone understand we need to really fund our schools appropriately to help them address this virus. It's a lot of, I get it, a lot of money being asked for, but we are in a war with a disease that is infecting this entire country. And the future of our nation is at risk because our students are the foundation for our nation. They need to be protected, as well as the educators that are giving them to be successful. So when you talk about challenges, what we've seen and what you've heard from everyone on your panel is that distance learning is not the best way. All parents, not one, want their schools to be reopened and their children to be at school. So it's really important that everyone understands parents are not against going back. in person. They're just worried about the safety of their students and of their children and of the educators as well. This is an essential business for our nation. We need to carefully fund it and enact the right resources for everyone to be successful. And that's why you saw PTA with the 5 asks that we're asking for. It's important. No matter what you do, remotely or hybrid, you're going to need this. And we ask that you do that as Congress.
All right, thank you. And before I forget, I seek unanimous consent to enter into the record short presentation submitted by Dr. Bobby Cruz, of the Director of Instructional Technology at the Northern Marianas Public School System. Miss Box, again, so among parents, was there a preferred rotating schedule, whether it's half day, 2 days a week, A, B, C schedule, or a day a week?
We know we didn't see a clear path for every parent is different, as every community is different. So I think really the best option for you and Congress is to think about giving local control, giving them the resources to be successful. If you ask them their first choice for their children to be in school, but again, safety is of utmost importance.
All right, so a national school board of education would not work. I mean, one size does not fit all, I think. My time is up, and I will submit. I have questions for the record. So at this time, I recognize the ranking member, Mr. Allen, for his 5 minutes of questioning. Thank you.
Thank you, Mr. Chairman. Dr. Swin, I want to thank you for being here today to talk about this critical topic. You know, I believe that every family has a right to educational options. And particularly this fall, I think the one thing that we might benefit from in this terrible pandemic we've been through is I'm seeing remarkable parental engagement in children's education now. And I'm seeing that the parents are seeing our education system a lot different. And I think they're going to be demanding options in the future. But obviously, every child is different. I've surveyed my grandchildren, and I've surveyed their parents. And, you know, one says, well, like Molly Kate, she can learn how to distance learn, but Hammond's got to be in school. And so every child is different. And I think that, again, the problem with Congress is it's been this one-size-fits-all, this is what you got to do. And what I hear from educators across the country is they don't have any flexibility when they get the funding because every school district is different. In your testimony, you discussed the choices you've had to make in Tennessee around physically reopening the schools. Have you looked at what's at stake if you don't set a goal of in-person learning to give parents that option this fall?
Yes, sir, and thank you so much for the question. I think Tennessee is a great example of a state that has urban, suburban, rural communities, all have different needs and challenges, and that's why we think that parent choice is so important about what's best for their own child. When we're thinking about the risks and consequences of not reopening schools and having that choice available, we've looked at our data and projected out the significant learning loss for students. I think many of you remember we had tornadoes before the pandemic, so some of our students have been out of school for 6 months and longer. So we know we're going to have learning loss. That affects our most vulnerable populations more than anyone else, and especially when we think about our early learners. We've looked at our child development statistics. We work closely across state agencies around that and have noted that more of our vulnerable populations are at risk and they rely on schools for services. It is logistically very difficult to provide those services if children are not in school. And so some of the things that we're thinking about are how do we get schools to open in a safe way and provide resources so that families have those options that are so critically important for their children.
Good, thank you. Well, I know you and I both care about students, and we care about their health and their welfare, but we also have to look at the economy, and I don't think these two things are mutually exclusive. In fact, this Congress is spending an enormous amount of money to try to deal with this pandemic. I don't think that's going to be good for our children. I think it's going to affect generations and generations and generations of our children because of this huge debt that we're building in this government, and it does not seem like that there's going to be an end. And I don't think I know it's not sustainable. But American families are struggling because of COVID-19, and they're concerned about their children's future. It seems clear to me that the primary way we can help struggling families now is by working to reopen schools. In other words, in our rural communities, we have got to reopen schools. I don't think we have a choice. We've already reopening businesses, and businesses are doing incredible, innovative work to make sure that we keep, one is our food supply. Can believe it. I mean, we had some challenges with that. But I recognize that reopening schools presents a lot of challenges, and there's so much we still don't know about this virus. Can you discuss the unique challenges that you have tackled in reopening the schools in Tennessee, and how can what you've been able to do help schools across this country? I think we need idea sharing, although every community is different. But what are some things you've implemented you'd like to share with us?
Absolutely. So briefly, we've done a lot with academics. We will an online academic system with video lessons. We've offered free PD for teachers and principals. Over 18,000 teachers and over half the principals in the state have PD ready to go back. Governor Lee has appropriated funds for face masks, gloves, disinfecting wipes, etc., for every single classroom in the state. So we've done a lot to make sure schools are safe and people are ready, and we'll continue to do more.
Thank you. Thank you very much. And I yield back.
Thank you, Ms. Allen. Yeah, we have
that alarm is obnoxious, if I could say that.
Yeah. Mr. Chairman, could they ring it 5 or 6 times and then stop? Because it makes it difficult to hear the witness.
Yeah.
I mean...
Well, I think...
Maybe one time.
All right, but I think the clock is when it rings, it stops. I mean, witnesses try their best to stay. They've actually stayed within the 5 minutes. I don't control the clock. I've got a cheap Casio here. No one can depend on it. It's actually brand new too, because I broke my. Anyway, next up, Ms. Hayes, our National Teacher of the Year. You have 5 minutes.
Thank you. Thank you to everyone for being here today. I think we all want schools to reopen and to go back to normal, but I think the reality is that no one can say with absolute certainty that we can do that safely. Not governors, not commissioners, not the Secretary of Education, not the President, not this committee. So I think we have to explore every available option and every precaution to keep students and faculty safe. My question is for Dr. O'Leary. I've talked to many in my district about plans that they have for reopening, and I'm concerned because none of those plans involve testing. Do you believe that states and districts should be responsible for ensuring that individuals in schools have access to testing if they request it or if that is needed?
Thank you for that question. It's an incredibly complicated issue right now. I wish we had more testing capacity in the U.S. That would greatly help matters right now. But I think, like many of the issues we're discussing, as I'm sure you're well aware, they're very contextual down to the district and even down to the school level. And so I know that schools across the country are asking that same question: how are we going to get testing done? So just to point out, I don't want testing all students before attending school. That doesn't appear to be a good approach, because if you're positive or if you're negative one day, it doesn't mean you're going to be negative the next day. So testing asymptomatic students and staff, I think, is really not in the cards at this point, given the testing capacity. In terms of testing symptomatic students, yes, we absolutely have to have plans in place for how to do that safely. As we approach the school year and inevitably some other respiratory viruses that can mimic COVID-19 are going to circulate. We need to have plans in place for how we handle that, and to get those tested with a turnaround time that is reasonable. The turnaround times really don't help you right now. So if you have waiting 7 days for a test, that doesn't help, and that is going to exclude students for longer than is necessary. Most of them are actually not going to have COVID-19. So I absolutely 100% agree with you that we need to come up with a good plan for testing, but again, it's going to be contextual at this point, even down to the school.
Thank you. Because what I've heard, I guess my granular question on that regard is, if you have a faculty member, a student, or someone who says, I feel symptomatic, can I be tested? So I understand that we can't do a universal testing plan, but no one has been able to answer to me if a staff member comes in and they say, I'm feeling symptomatic. Most of the responses that I've gotten is that they would have to seek some type of community-based testing or figure it out on their own. There's a national poll of school principals that found that many principals are concerned over the safety of their staff, especially those who are older or immunocompromised. Dr. Hinojosa, do you have a plan to address the concerns of our most vulnerable staff members?
Yes, absolutely. Thank you.
And I mean not just teachers, everyone in the building, cafeteria workers, vendors, everyone who's in and out of our educational spaces.
No, absolutely. We have a form that we've distributed to all of our employees to give us specific information on their health conditions, and then we will handle those on a case-by-case basis. What you described is an issue that we faced this summer as we were trying to distribute food, 500,000 meals a week to our employees. We had difficulty finding enough employees to come and distribute the meals. That's why we went to 1 day a week to distribute meals and technology to all of our students. So we do have a plan. We ask them to identify, and then we'll work with them individually on how we execute that. But I concur with the principal's feeling on that, because they've communicated that very same feeling to us locally here in this district.
Thank you. I've also heard from leaders that they're afraid that this situation may lead to a shortage of full-time teachers and substitute teachers. I think there's a population that we haven't really talked about. How would this potential shortage in the teacher workforce affect students with disabilities? Dr. Hinojosa.
Yeah, students with disabilities is probably our biggest concern right now, because actually many of them, especially medically fragile students, the teachers need to get very close to them. And if they already have a medical condition, this is going to exacerbate the shortage area. We have shortage of bilingual and special ed teachers. So this situation is not going to help. In fact, it will make more difficult to hire qualified employees in these positions.
Thank you. My time is about to expire, but Dr. Schwinn, I have just one question. Can anything that you've talked about or any of the interventions that you've discussed happen without government or federal resources and support? Yes or no?
We will appreciate any resources that will help us open schools safely.
Can you do it without it? Yes or no?
Those resources will be incredibly
Yes
helpful
or no?
for schools. That is the answer. Tennessee's doing great work to make sure we can reopen our schools safely.
Thank you.
Thank you very much, Ms. Hayes. I'd now like to recognize the full committee ranking member, Dr. Fox, for 5 minutes, please.
Thank you, Mr. Chairman. And I want to thank all of our witnesses for participating in the hearing today, and particularly to Dr. Schwinn for being here in the committee room. Thank you for the work you and your schools have done in Tennessee to serve the students since the outbreak, and for coming here today to discuss the ways we can help students get the education they need in the upcoming year. In many ways, the best way to do so is in person. Despite commendable efforts by educators, students, and families during the unexpected months of remote learning, it's clear that for many students, the greatest chance for success is to have in-person instruction in the classroom. Can you describe the advantages of having students in person this fall?
Absolutely, and thank you for that question. I think that it is critical that we have opportunities for students to be in person. I have 2 young daughters myself. Both are in 3rd grade and one is in kindergarten. And so thinking about for our very young learners the need to learn to read, that is very difficult to do remotely. We also know that many of our students rely on services like special education. To go to a previous question, Tennessee's looking at innovative options like having 200 teachers get endorsements for special education at the cost to the state so that we can provide those resources in schools. But when we think about what schools provide, health care, counseling services, et cetera, that can be done in schools, and schools being reopened is incredibly important for those.
Well, it sounds to me like you're focusing on students, and that's something that needs to be done. I have said for years, schools are basically focused on administrators and teachers and their convenience, not for focusing on students. So thank you for that. So again, the focus is often on the obstacles, but I believe we can find ways to overcome these challenges just in the 2 examples you gave. Prior to March 2020, one might have said that transitioning all classes online was inconceivable, but many schools accomplished this feat swiftly. So, Dr. Schwinn, what makes you so confident that it is, in fact, possible to reopen schools safely in person this fall? What evidence do you have to support your decision?
I appreciate that question, and I think it's a great opportunity to talk about how adults can support children. So in the state of Tennessee, our state legislature, our governor, and we have a history of governors who have committed to education in the state. We have not reduced state funding to public schools in the state of Tennessee. Governor Lee has allocated millions of dollars for technology, safety equipment, resources, health and sanitation equipment for schools. All of that is so that our schools can reopen because we understand how important it is for our families and for our children. We also know how important it is for our staff, teachers, as well as support staff and district staff. We are getting them what they need so that they can do the really hard work about educating our students, and we know that that has got to be the priority.
Thank you again. Dr. Schwinn, much has been learned over the past several months about the coronavirus and its consequences for education. In addition to the research that provides new insights into the risk of COVID-19, particularly to young people, there's also more information available about the effectiveness of education in a remote environment. How does this information and research inform your plans for safely reopening schools this fall?
Sure. So, and as a mom of two children who was doing the same balance as many families, understanding how difficult it is to both do your job and then certainly to support learning at home. And I think we've heard that from parents across the country. Look, our teachers have been working incredibly hard. Our principals and our superintendents have been working incredibly hard to do what they could in a remote environment. But nothing replaces the relationship and quality of instruction that happens between a teacher and his or her children in the classroom. We know that's where this really wonderful learning takes place. And so our efforts and supports have been certainly to provide remote options for those staff and students who need them, but knowing that the most high quality education happens in the classroom for students at all levels, but particularly those who are most vulnerable and in our youngest grades.
Well, again, thank you. Thank you for what Tennessee is doing. Thank you for your leadership. I am so incredibly impressed to hear your emphasis on the students. I believe that in many cases, that's being lost in this discussion about not reopening schools, and that is, what are the needs of the individual students? Our colleagues on the other side of the aisle continually talk about the need for the personal approach to all students. We need to keep that in mind in all the decisions we make. Thank you, Mr. Chairman. I yield back.
Thank you very much, Ms. Fox. I now recognize Ms. Schreier for 5 minutes, please.
Thank you, Mr. Chairman, and thank you to all of our witnesses. I very much appreciate this testimony, and I want to tell you that I am speaking from the standpoint of being a pediatrician, so there is no question that I have the students' best interests in mind. I'm also speaking to you as a parent with type 1 diabetes, and so I have the interests of other parents with pre-existing conditions or grandparents at home in mind, and I am speaking to you as a daughter of a teacher. So I am looking at all of these things, and I would just remind my colleagues on the other side of the aisle that you can't open schools without adults, and also that kids don't live in a vacuum. We do know that kids are better served in school. I experienced remote education with my son, and frankly, it was pretty lousy. And so we all want our children back in school. We know it's better for them academically, socially. We know kids who need nutrition and childcare through schools need to be there. But we also know that other countries wisely have not opened while rates are surging, because that essentially dooms this process to failure. We also know now that kids 10 and up seem to spread this just as readily as adults, putting families in danger. And so while we know that children are less affected and tend to remain either asymptomatic or mildly symptomatic, they don't live in a vacuum. And what this seems to come down to for me is really the level of community spread. Because if there are high levels in the community, there will be high levels in the school, and you will end up closing and quarantining an awful lot. And so my first question is for Dr. O'Leary, which is just, is there a number, either developed by states or, gosh, it would be really nice to have a national number that just says, hey, if levels are below some number, 1 in 100,000, 1 in 10,000, then it is considered a safe incidence or safe prevalence to open our schools, or is that based on the R0? And as you're answering that question, would it be helpful to have that information from the CDC, since different communities have different levels of disease and different R0s?
Thank you for that question, Representative Schreier. Can you hear me okay?
Yes.
So the R0 is the reproductive number, is one measure that a lot of folks are using to help make these determinations. It's an incredibly complicated calculus, and it's done at the local level, the state level, and states are tracking their numbers differently in different ways. They have different benchmarks for how they're making these decisions, and they're complicated. So again, R0 is one number, but other numbers include, as you point out, the incidence of disease, the rate of rise of disease, the percentage of positive tests, the number of hospitalizations in a community. There are quite a few metrics that people are using. I know CDC is also working on, what are the best ways to make these decisions, but it's really a complicated discussion between CDC, local and state public health, as well as the schools and the educators, because again, it is very contextual.
Thank you. It seems to me it would be helpful to have that number, and it's nice to hear that the CDC is working on it, to have that, because I think it would inform the administration as well, that we know that different communities, different school districts are in different situations, and that to blanketly say all schools should open is just irresponsible. And so that kind of data would be very helpful. My next question is for Dr. Hinojosa, which is about remote learning. And like I said, our experience with that was very substandard. Are there other methods, perhaps through TV, anything else that could bridge the digital divide, because we just can't get broadband to every child and they can't do their homework in a car?
Yeah, I do want to acknowledge public broadcasting systems in many cities, including LA and Dallas and other places where they've got a contract, an agreement with us where we actually provide some television opportunities for teachers. For students and families, but we also need to do better on learning at home 2.0. Number one, or 1.0, we just put things together. Right now, we're training our teachers on the tools and the content, and both of those are very important. That's why buying a little bit more time will help us do a better job to have quality instruction. So thank you for the question, Representative.
And are there some superstar teachers out there who are really good with online instruction, who could basically spoon feed this to all the school districts out there, so they're not so each teacher isn't inventing the wheel on their own?
Yeah, we're actually studying that right now. We have a differentiation of our effective teachers, and now we want to know which ones are most effective in this context. And so we're trying to do that research ourselves.
Thank you, Ms. Schreier. Thank you very much. Mr. Thompson, you have 5 minutes, GT.
Chairman, thank you. Appreciate it. Thank you to all members of the panel on this very timely and incredibly important discussion. Dr. Shin Swin, first of all, I just want to say thank you publicly to all the life essential employees that are out there. That's kind of a term that's taken on new meaning in this pandemic. But a thank you to the folks who show up to work each and every day, of different ages and diversity, and in grocery stores, convenience stores, manufacturing, making the personal protective equipment, the other things that we deem as being needed, our first responders, our healthcare providers. And so I want to say, do you think that teachers fall into that category as life essential? And I guess if why or why not?
Thank you for that question, and I come proudly from a family of teachers, many of whom are starting school this year. And so when I think about what is critically important to the foundation of our country, public schools are part of that. It is the fabric of who we are and how we educate our children. And so certainly when we think about the impacts of children going to school and being able to live whatever lives they choose, when we think about how families rely on schools, and certainly when we think about opening up our economy so that families can get back to work, we need to be able to provide those options to all of our parents, so that whether they choose to educate their children remotely or choose to send their kids to school, that option is available. And so I think it's incredibly important we provide those.
Yeah, no, I would agree. I think I put them right. I'm a big fan of teachers. I think they're life essential. It's the immediate, intermediate, and long-term educational benefits. The mandatory reporter role. A lot of these kids are sheltering at home with distance learning with their abusers, unfortunately. It's being able to get access to the nutrition that they need. So I would encourage, I think our school districts need flexibility, and the CDC guidelines specify that, and talk about cohorting, talking about different suggestions, just guidance. And as a recovering school board member, I found that very helpful and meaningful as I read and digested that. And I think they need the flexibility to be able to perform their function as life essential employees. I'm really appreciative of the things that I've heard about students with disabilities. I think that those students in particular are very vulnerable, and it's very, very difficult, and we need to figure out a better hybrid. Distance learning I don't think is working for those students, and they're really at risk. A student that I haven't heard talked about, but I'm obviously the chairman knows him, I get pretty passionate about career and technical education. You know, career and technical education is actually preparing our future life essential employees. The people that I named off here are kind of career and technical education fields. And we really, our school districts need to take a look at keeping that in mind, because those are hands-on. And when these kids graduate, they're going to be life essential employees during the next pandemic. Unfortunately, these things travel at the speed of jet airplanes in hours and days, not months and years anymore. And so to short them in their education so that they're not prepared with the skills to be able to go into the workforce, to be there to provide for us in the future. So any thoughts in terms of how we could do a better job for those students that are in career and technical education tracks?
Yeah, I appreciate the question, especially in this room, and we've got our CTE week this week, actually. And so I think about Gibson County, I think about Kingsport City, I think about Clarksville, Montgomery. These are districts in Tennessee who are tackling those problems. And one of the things that's come from our superintendents is how can the state fund curriculum that can be used, whether the student is in school or in a remote environment, and going back and forth, because we know classrooms may need to close throughout the year. So the state is looking to invest in those types of remote to classroom opportunities for students, and we are partnering, and again, cross-agency support is critical, partnering with other state agencies, working closely together under Governor Lee's administration so that our workforce development group can support our schools to still provide those opportunities.
Yeah, you know, and within months, hopefully maybe weeks after these students graduate from these career and technical education programs, some of them will be going to work still in the middle of this pandemic. So we need to figure out how we do in classroom, whether it's whatever the skills are, whatever that area, so they can do that safely as a future life essential employee. So I would argue that, you know, distance learning and modules that are, you know, they need to be in those settings because they're going to be working in those settings. And education is a lot more than probably just a diploma. It's about really preparation to work and survive and succeed in the world that we live in.
Thank you.
Gentlemen, thank you.
Thank you, Mr. Thompson. Without losing her place on the question list, I will pass on Ms. Shalala at this time and recognize Ms. Davis for 5 minutes.
Thank you, Mr. Chairman, and thank you to all of you who are present with us, but also very active in this discussion. We appreciate that greatly. I wanted to turn to Dr. O'Leary, because Dr. O'Leary, I know that your testimony suggests that schools that are forced to delay in-person openings need more resources, not less. And yet the proposals that we're hearing seem to suggest that if schools are not able to do that because there's a fire raging in their community, the virus, that they should be not given any resources in order to fund them. So, Dr. O'Leary, what do you think about that proposal?
Yeah, thank you for that question. I think just to put it in context, you know, imagine if you're in a community where there is a lot of virus circulating and you have lots of different people getting infected. It's inevitable that the virus, sorry, I think there might be a bandwidth issue, but it's inevitable that the virus is going to get into the schools, and the schools are going to have to shut down. So it doesn't make sense where there is widespread community circulation to open schools, no matter how many mitigation measures are in place, to withhold funding from those districts because they can't open. I mean, they really can't open in that circumstance, and those decisions need to be made with local and state public health.
Thank you. One of the issues that's been raised, and I know, Dr. Schwinn, you probably relate to this as well, is you need to have the connectivity for students to be able to even have a fighting chance to be able to not keep continuing to fall back, and we know for all children that they did. You were not willing to really answer my colleague's question about whether schools need more resources. But if you were asked, along with other education commissioners throughout the country, if you wanted more resources, if you felt it would help the children in your school district, in your state, what would you say? Would you say, no, don't worry, I'm okay, I don't need anything?
I would say absolutely we want more resources to open schools. What I don't want to say is that we will make decisions for 147 very unique districts and counties simply by waiting for the federal government. Tennessee will protect our own, and we will certainly allow our superintendents to make decisions that are right for their own communities. But certainly we welcome and need additional resources to do so with complete safety in mind.
Yeah, Dr. Hinojosa, could you respond as well as the Dallas superintendent? Because I know that you certainly are in a position as a superintendent to see that the city of Dallas itself has lost, nearly $33 million in tax revenue in 2020, and that impacts the schools. Am I correct?
Yes, absolutely. Well, it'll impact us significantly. Sales tax are down in the state of Texas. All revenues are down in the state of Texas. So we're going to hit this big ball. And if we don't have the resources, but more importantly, back to your original question about Operation Connectivity, we've even asked the FCC to relax some of their requirements so that we could use some of the resources that are in FCC so we could actually use them to knock down the front door and have families access connectivity. So yes, we definitely need additional resources. And if you think about high poverty states where Title I and special ed dollars, IDEA dollars, those are well within the federal government's purview, and those would be extremely welcome during this time. And
would you like to see, I guess, Dr. Hinojosa, would you like to see Congress then address that issue?
Yes, I would love to see Congress to address that issue. We've already done it in the House. We'd like for the Senate to consider it. Thank you for the CARES Act, but we also think that the HEROES Act has a potential to significantly help districts throughout the country.
And I want to go back to Dr. O'Leary for a second, because one of the issues that's been raised is that school districts have to develop protocols in order to deal with the ifs. What if one day, right after school is open, you have several teachers that come down with COVID? What if you find that in a classroom, children have symptoms and Are there protocols out there that the Pediatric Association is dealing with, is trying to suggest to schools? Do you think that what the CDC has done has helped people with those specific kind of protocols? Because that could be really a very dangerous situation.
Yeah, those protocols are being actively worked on as we speak, and including from members of the Academy. CDC is working on this, state and local health department. Absolutely.
Thank you.
Thank you.
Thank you, Ms. Davis. I now recognize the gentleman from Wisconsin, Mr. Groffman, for 5 minutes.
Thank you. Glad to be here. We'll give Dr. Schwinn some questions. It seems to be little doubt that children spread COVID-19 less rapidly than adults. Is that so?
According to our Department of Health in Tennessee, yes.
Can you expand on some of that claims and explain why those aspects need to be looked at when determining whether or not we send kids back to school, the effect of that?
Sure. I think, again, pointing to the exceptional leaders that we have in Tennessee who are responsible for our school districts, there are a lot of conversations about prioritizing our younger students. Our superintendents are being incredibly creative about that because we know the spread of the virus is less in our younger students, and so trying to think about different options that allow for us to bring those, especially that age group, back into school and spread out social distancing, et cetera. So that is a priority in Tennessee, and we've seen that reflected in our schools.
Sometimes I think that our whole bureaucracy in dealing with this thing doesn't look outside the United States enough. And at least the papers in front of me claim that countries like Switzerland and Netherlands are saying that children play even a minor role in spreading the virus. Have you heard that, or do you think Switzerland and Netherlands are right in that or not?
I don't think I'd be able to speak specifically on any kind of health conditions or studies that have been done there, but I do know that when we are looking at the best practices from other countries, what we are seeing is that there are solutions we can put into place in our schools that protect students and staff and allows children to continue to be educated in person as long as we provide them with the resources necessary to do so safely, and that's what we've been focusing on.
One suggestion in Wisconsin, apparently, is that you propose guidelines where you have a 4-day week and a 5th day for cleaning, but kids on a 2-day rotation. Have you heard about that, and could you kind of comment on that?
Sure. So we have a similar, we have a district who's looking at similar options around bringing students in on A-day, B-days, and allowing for alternative classrooms or alternate classrooms to be cleaned on those on and off days. Frankly, we'll be doing the same thing at the Department of Education with our desks in our own office space. So we are looking at that. We are also seeing districts who are bringing in younger students K through 8 across all of their schools and having high schoolers do more remote A-day, B-days. So we're seeing that same alternate scheduling to allow for disinfecting procedures to take place.
Okay, you're kind of following what's going on nationwide. Mm-hmm. In Wisconsin so far, or at least whenever whoever put it together, nobody under age 20 has died of the COVID. Is that true nationwide, or is it restricted if people die, to people with serious health problems? Or could you kind of elaborate on the level of sickness for people under 20?
You know, I can certainly speak in generalities. I would probably defer to a health professional related to that data. I do know when we're thinking about risk factors, we are making sure that depending on the age range, and certainly, and that goes from students all the way to staff, that they have what they need, including personal protective equipment to keep themselves safe. And certainly I have relatives in Wisconsin, and so special, near and dear to my heart to make sure that they are safe in schools in that state as well.
We'll get their name later, and I'll look out for them, but we'll do that after the hearing. Some of my colleagues and national pundits have said that putting kids to school if you let the kids in school, you're putting their health at risk. Nobody I know talks about reopening schools without making sure the kids are not at risk. But do you think the conversation should really be about reopening the schools safely and how it will benefit children?
I do, especially because, you know, I was talking with the superintendent yesterday morning in Pickett County. She has very few cases in her county. Her district wants to open up in person. That is certainly very different than Metro Nashville or Shelby County, where Memphis is, that has a different population and skyrocketing cases. Local communities need to make local choices, but the conversation needs to be how we do so safely.
I'll give you another question. I'm not sure this exactly applies to schools. But last week when I was home, I looked at one of what used to be called a sheltered workshop. In other words, people who are used to be called handicapped working there. And I have a special interest in people like that. We had a shutdown in Wisconsin like a lot of states. So these folks couldn't come in and work for like 3 months. And when they came back, the staff could really tell psychologically it was damaging to them, not having a school to go to. Because I think particularly for folks in that situation, the workplace is their social setting as well. Could you comment on any special concerns we would have or special damage that would happen if you have people with special needs who are not able to go to school and see their peer group? Is it especially damaging to people like that?
I have a strong concern, especially when we think about our vulnerable populations, inclusive of our children with disabilities. The Department of Education put forward a $5 million compensatory services grant and a $1 million assistive technology grant. It is not enough to serve children in a remote setting. That's why we know that we need to bring certain students in to provide that in-person instruction. It's incredibly important to them and their health.
Thank you, Dr. Swin. Thank you very much. At this time, I'd like to recognize Ms. Shalala for 5 minutes, please. Ms. Shalala, are you on remotely? All right, we'll move on. Ms. Wilson of Florida. Ms. Wilson? All right. Mr. DeSaulnier, California, sir? I'll move on. Mr. Morelli of New York. Okay, he's on the floor. So let's try Mr. Keller. Is
No,
here
I'm
in the
here.
room? Hello?
No, Mr. Morelli, I'm sorry. I was searching for my mute button.
Okay. Oh, Mr. Morelli, hi, good morning. You're 5 minutes, sir. Thank you.
Great. Thank you, Mr. Chairman, and thank you for holding, I think, one of the most important hearings that you could hold. Obviously, as we look towards the fall, this is a time of year when students and teachers and parents are happily preparing for the return to school. Teachers refreshing curriculum, setting up classrooms and ready to welcome their students. Parents and children gathering school supplies, reviewing schedules and getting excited about the first day of the new school year, but obviously nothing to put it to suggesting that's a major understatement. Nothing is normal about this year. Principals and teachers are stressed about providing a safe environment for their students with limited resources. Parents worry whether the child will be exposed to the virus in the classroom, as well as how to balance work and daycare if you're in a district where schools are going to provide education remotely through distance learning. So I think we can all agree we want students back in the classroom, but only under safe conditions, and that rushing to do this is terribly inappropriate. So we need to safely open schools and follow clear public health guidelines. I think that's what Dr. Fauci has said repeatedly about that. And I think if the administration was serious about getting students back in the classrooms, we need fewer tweets and more meaningful action and resources devoted towards schools to help them get to the point where they can reopen. And rather than blocking the CDC from testifying before the House for fear of what they'll say, let's see a commitment to sharing data and providing clear guidance for industries that repeatedly are calling for assistance. And let's put the political agenda aside and utilize the Defense Production Act to ramp up testing immediately and demonstrate leadership for the American people so rightly deserve. And I am proud of this body that we've showed this country we are serious about providing support. I know colleagues have said it's not sustainable, but there's nothing that we want to sustain about this situation. We need to act. This is, as I often say, people talk about, well, you should only do that in case of a really rainy day. Well, this isn't a rainy day. This is a torrential downpour, and we need to do everything we can. That's why I think the HEROES Act was so important, provided $200 billion in funding for K-12 schools, and waiting for actions our colleagues has been incredibly frustrating, especially when so much is at stake. I think we're on the right side of history, and we're gathered here today to continue the important conversations. I think the President and Secretary DeVos have publicly come out and demanded schools reopen full-time in person. I think that's wrong-headed. CDC guidance, which categorizes full-size in-person classes and activities to be the highest risk of transformation and transmission of the disease. So with that, I wanted to ask Dr. O'Leary, and I partly wanted to ask as a follow-up to the conversation my colleague, Ms. Hayes, asked about testing. But first of all, someone said that the transmission of the virus among children, obviously, even those who are asymptomatic, could put teachers and adults in the building at risk. I want you to talk about that. And also, could you just comment? I thought I heard someone say that the transmission was less among children. Could you talk about the science of that and whether or not that's actually true?
Yeah, thank you for that question. So we're learning more every day about this issue. At this point, it appears that younger children appear to be less likely to get infected and less likely to spread it. But that by no means means that they can't get it and they can't spread it, and that some don't get sick. So yes, they're at lower risk. Yes, they can get it and can spread it.
So can I just for clarification, the reason it's harder for them to spread is because they're less likely to get it in the first place, or is there something even for those children who have the virus, who contracted it, it's harder for them to transmit? So those are kind of two pieces, right?
Yeah, so it appears to be both. And we can talk another time about why that is. But yeah, younger kids appear to be less likely to get it and less likely to.
So I also wanted to go to the question of testing, because you seem to suggest that testing students was not a viable option. But is that simply because you don't think we have the capacity, or we demonstrated the capacity at the federal government to ramp up testing and make it available? Or are there other issues with testing students? Because clearly, if one tests positive, you'd want to get them out of the classroom and quarantine them at home, even if they're asymptomatic but have contracted the virus. Could you just comment on that?
Yeah, let me be clear. I'm talking about not testing asymptomatic students, like all students prior to the school year. We don't have that capacity in the U.S. We do want to try and test students that are symptomatic to the extent that that's possible, but it really varies a lot across the country.
But just to be clear, I'm sorry, is my time expired?
Yeah, thank you, Dr. Leary. Thank you, Mr. Morelli. At this time, I recognize Mr. Keller for 5 minutes, please.
Thank you, Mr. Chairman, and I'd like to thank the chairman and the ranking member for holding this critically important hearing today on how our nation can move forward with safely reopening our schools. Additionally, I would like to thank the witnesses for participating today and for offering their valued perspective and expertise. As a father of two and a proud grandfather, I'm extremely concerned about the long-term impacts that COVID-19 has had on students as a result of being out of the classroom for months at a time. One example is a McKinsey & Company has projected that when all the impacts of COVID-19 are considered, students should fall an average of 7 months behind academically. This is simply unacceptable. We owe every generation of students a well-rounded education that encompasses the educational, social, mental, and physical benefits that come with students attending school. Additionally, I commend Congress for working together to provide schools with billions in dollars for relief. The Elementary and Secondary School Emergency Relief Fund, authorized under the CARES Act, provided $13.2 billion in formula funding directly to states and school districts to help schools respond to COVID-19. My home state, Pennsylvania, received almost $524 million for local educational agencies to address the impact of COVID-19. However, it is my understanding that not one state has spent the entirety of their funding under the CARES Act. While the Pennsylvania General Assembly has appropriated much of the money, there's still about $1.3 billion unspent in the Pennsylvania Treasury. Across Pennsylvania's 12th congressional district, districts are approving reopening plans for the fall, working in conjunction with local school boards, administrators, parents, and state officials. One central Pennsylvania school district surveyed parents and found that 60% of the respondents favored return to in-person schooling this fall. I was thrilled to read this morning that the Williamsport Area School District, located in Pennsylvania's 12th Congressional District, has outlined a thorough 3 educational phases plan to reopen schools in the fall that include a hybrid of in-person learning and remote learning based on the level of transmission risk. Today, I'm eager to hear about how remaining CARES funding can be utilized to safely open schools and learn more about the specific actions schools are taking to make sure students, teachers, staff, and families can attend school safely and in person this fall. Dr. Schwinn, I look at schools, and when schools across the country closed in March, scientists and policymakers alike had limited information as to the implications of the coronavirus and what they were for children. Although there are still lingering questions regarding the novel coronavirus, one thing most scientists agree on is that the risks to adolescents are extremely low. Thus, it appears that you can open schools safely for students while you still need to look at how to protect the staff. Doesn't this knowledge help make the decision to open schools a little bit easier?
Yes, thank you for the question. And I think that bringing both of your, I think, really important points together, when we look at our ESSER funds or our CARES funds and how our districts are choosing to spend that on technology and certainly on safety and disinfecting equipment so that we can open, we also know that there has to be a priority on providing every child with that opportunity. I've spent my career supporting those students in the most vulnerable populations because education is such a critical vehicle for them being able to support themselves for the rest of their lives. And that's our focus on in Tennessee. So certainly we know that protecting our adults allows us to open schools in a way that is safe and supportive at local communities, and that will continue to be our priority.
Thank you. And just to follow up, how is your agency working to make sure school leaders and personnel, as well as parents, have the facts and not invoking fear and rhetoric to help make decisions about school?
Yeah, and that communication is always so challenging, I think, as you're well noting. So one of the things that we're doing is we had an educator survey. 25,000 teachers in the state of Tennessee took a survey through our partnership with Vanderbilt to be able to know what it is that they were challenged by. We're working closely with the Department of Health, and on Friday we will release a number of parent-facing supports and resources to communicate. One of those will be a family website in partnership with Trevecca to be able to communicate directly to parents about what the information is and what their choices are that they can make for their own children.
Okay, thank you. I just have a question for Dr. O'Leary. It was questioned about how kids transmit the coronavirus, and you just got done talking to one of my colleagues about that. So we know that it transmits differently with adolescents, and kids aren't as at risk to transmit. Is that true?
There does appear to be a difference between younger children and older children, yes. But
Yeah.
again, learning every day.
How does it transmit differently than the flu? Or is it similar to that?
Well, it's different. Children are clearly drivers of influenza epidemics. That appears to be less the case with this.
All right. Thank you. Thank you, Mr. Keller.
Thank you.
And now I'd like to recognize Ms. Shalala for 5 minutes. Ms. Shalala, are you on remotely? Okay. She's on the floor. The chairman of the full committee, Mr. Scott. Sir, you have 5 minutes and
Thank you, Mr. Chairman.
time.
We've heard comments about the desirability of opening schools. Of course, that's how you get better academic achievement, socializing skills, nutrition, access to nutrition, detect child abuse, and you're not going to reopen the economy without reopening the schools. So, of course, we want to reopen the schools if it can be done safely. And so, Dr. O'Leary, let me ask you a question about ventilation. 4 in 10 school districts, it's been found, need to update or replace HVAC systems, heating, ventilation, and air conditioning systems in at least half their schools. Why is ventilation so important?
Yeah, I don't want to pretend to be an environmental engineer, but it does appear that ventilation matters with the spread of this particular virus. And, for example, we know that the virus transmits much less in an outdoor environment than in an indoor environment. And so having circulation within classrooms is important, but that's, another one of the reasons that schools need resources to address ventilation. That's one example of many of the reasons that schools need resources to deal with trying to reopen.
Thank you. In the Moving Forward Act, the infrastructure bill, we have significant funding for school construction that could take care of that. And Dr. O'Leary, if we're not going to test all the students on day one to know who is infected and who isn't, you have to assume that students coming from the community all into one place, somebody's going to be infected. What is the plan to deal with a student who is beginning to show symptoms? What should be the protocol at that point?
Yeah, I think that speaks to the issue of why we need to act across the U.S. right now to drive infections down as much as is possible with wearing face coverings, physical distancing, et cetera, because if we can drive infections down as a country, then that issue is going to become much less of a problem.
Well, statistically, there will be children who will present in school and show symptoms that they're infected. After they show symptoms, that means they've been in school for all those days, asymptomatic or pre-symptomatic, spreading the disease around. What should be the protocol when you find someone who is symptomatic?
Yeah, so those protocols are being developed right now at the federal, state, district, and even school level. So there are. We could talk for an hour about details of those protocols, but basically what they are trying to do is screen students to identify who might be ill, and strong encouragement for parents to keep their kids home when they have any symptoms, including fever, runny nose, et cetera. There are screening protocols being put in place, such as having an app or some kind of a based system that parents can screen prior to sending their child to school. There are difficulties in trying to do that at school. For example, letting children line up to get their temperature taken, that could present more problems than it solves. So these issues are being worked out right now. And again, it comes down to the level of the individual school for how that may be done.
Well, if you wait for the symptoms to occur, it's too late. If someone has been found to be positive, do you shut the school down?
The various plans that are coming into shape usually involve cohorting students, so that if there is a student identified as having been infected with COVID-19, it's only the people that they're in close contact with, and then it also depends on the number of students that are infected, et cetera. So it's not as simple as saying if you get one case in a school, you shut the school down.
Okay, should we have nurses in the school?
I'm sorry, could you repeat the question?
Should we have nurses in every school?
I would love to have a full-time school nurse in every school. School nurses have been shown to improve health outcomes across the board. Being in schools, unfortunately, that's not currently the reality in the U.S.
Thank you. I think by the time I get the next question in, my time will expire. I'll yield back.
All right, thank you, Chairman Scott. Mr. Vandrew. All right, Mr. Walberg. I'll go to Dr. Murphy. Dr. Murphy, you have 5 minutes. Your mic.
There you go. Technology is wonderful. Thank you. This is my first question is for Dr. O'Leary, actually. I was reading a couple journal articles last evening. We talked about immunity, antibody immunity, and cellular immunity. It was interesting to point out that a lot of studies now are talking about antibody immunity waning after several months, and that T-cell immunity is going to be really what's going to get hold of this. And I was wondering if you could speak to, and this looks as why that children are by all means relatively spared from this compared to adults just because of their thymus gland and everything as we burn out as we get older. I was wondering if you could speak to that a little bit. You know, our kids are obviously our biggest concern, and putting them behind in their education is why we're all here to try to correct that. But I think I'd really like to know what you truly believe is the relative risk of our children. In the state of North Carolina, we've had 3 fatalities in kids under 24, all with comorbid diseases. And let's give a real true picture of what the true risk is for our kids under age 18 as we move forward. And give me the R naught. Give me the things that you truly believe are our kids at risk, and not just hypothetical. I really truly like to look at what we've learned so far from Korea, German studies, and all these things. What are we truly looking at for the risk of our kids as we go back to school?
Yeah, so you've asked several complicated questions.
Yeah, I tell you what, forget the T-cell immunity one. That's pretty heady there. Let's just talk about the true relative risk for our kids.
Yeah, so again, learning every day. But what we have seen so far in the U.S. is that kids are around the world, kids do appear to be less impacted from COVID-19 than adults. That is fairly clear. In terms of the actual numbers, I think we're still trying to get a handle on that, because we don't have a good sense of the denominator of children that have been infected. We also, the understanding of the biology of the virus is still really rapidly evolving. There have been some studies suggesting that the overall risk for mortality is less than, for children, I should say, is less than several other things that we commonly accept on a daily basis in society, such as trauma, influenza, the things that sort of happen all the time.
Yeah, so I'm sorry to interrupt. I just want, because I want to get one other question in. Just from what I was reading last night, the relative risk, as it's calculated out of the best of my calculations, was 0.011%. That is 1 in 10,000. So if we look at the number of kids who die every year from flu in the United States, it is going to seemingly be a fairly comparable number, and we don't shut down our schools every year. And so, I just want to take the fear factor out of this. I just want us to deal with the non-politics, with the true part of this, that we can put our kids back to school safely, and we need to stop the fear-mongering. We need to get our kids back on track. So anyway, thank you. And in that same line, this question is for Dr. Schwinn. I had a great telephone town hall with across the school administrators from our district this morning. They're all concerned about all the details, which we all are. I was wondering if you could speak to liability. I've actually put forth a Open Schools Responsibility Act that basically holds our school institutions free from frivolous lawsuits because of this, because it's just one less thing that they have to worry about. And I wonder if you could speak to that, Dr. Schwinn, briefly.
Sure, I'm happy to, and that's an ongoing conversation in Tennessee as well, and I know our legislature is looking to pick that back up in August. I think when I talk with superintendents, one of the things among the many concerns that they have is around how to ensure they can make the best decisions possible for children and for their staff, and I think liability is one of those concerns that is getting into the conversation outside of the outcomes that we're driving towards. So I think it's a worthwhile conversation and one that we are incredibly grateful is happening at both the federal and the state level.
Great. Thank you so much. It looks like my time is just about out. I'll yield back. Thank you, Mr. Chairman.
Well, thank you, Dr. Murphy. I'd now like Mr. Courtney. Mr. Courtney.
Yes, Mr. Chairman.
All right.
Thank you.
5 minutes, please.
Yes, thank you. I appreciate again holding this hearing, which is the question of the day, I think, for our country in many different respects. This morning, the Department of Labor reported 1.4 million new unemployment filings, which actually is the first time in 3 months that number has gone up. And just really, unfortunately, validates what the chairman of the Federal Reserve has been saying since last May, which is that the CARES Act stimulus was inadequate in terms of addressing a whole host of issues, and that the country needs more fiscal stimulus. The most efficient way to do that, to accomplish that, is to provide more funding for state and local assistance, because that, again, will circulate into the economy the quickest and will enable us to solve the problem, which we're trying to figure out here this morning, which is how to safely reopen schools. Again, I think it's clear both sides can stipulate to the fact that opening up schools is highly beneficial, and it's a goal we all share. The question is, how do we do it safely? A couple days ago, the Secretary of the Education, in an interview, actually made a comment that we should open schools because children are actually stoppers, and that was the term that she used of COVID-19, which, when asked by the press afterwards what she meant by that, the Department of Education cited a study in Saxony, Germany, which again echoed some of the comments that we've had here this morning about the fact that young kids, particularly smaller kids, are not, they don't transmit as much as older children or adults. But the researchers, when they were interviewed after the secretary made her comment, were careful to point out that their results depict a situation with low infection rates after the initial transmission peak is under control. If you do have rising infection rates, as in the US, and this is a quote from the researchers in Germany, putting people in close contact will obviously lead to transmission of respiratory viruses. So the question I wanted to ask Dr. O'Leary is just, that's sort of the issue we have to grapple with here. If there are parts of the country where infection rates are going up in the population at large, the decision to reopen schools is a different one than in other parts of the country where infection rates are low or below the 1% positivity rate. Is that, what the Association of Pediatricians, is that sort of your take in terms of evaluating, this decision?
That is absolutely correct. It varies depending on what's going on. And I think, there's a lot of discussion of other countries, but what is rarely mentioned is that the situation in all of these other countries where they've attempted to reopen schools is vastly different than what we're seeing in most parts of the US. And so, yes, it's important to draw lessons from what they're doing in other countries, but we can't simply say, oh, look, they did it, and so we can too. You really have to base it on the local epidemiology.
And again, the researchers, which the department was relying on, made that precise point, which is that, you've got to deal with the overall population of a country or a region before you can, sort of extrapolate from that it's all clear in terms of reopening schools. And again, in Israel, they, again, had a very bad experience in terms of school reopenings and the number of students who became infected, as well as almost 700 staff members. And they had to, again, really hunker down in terms of trying to respond to that. Again, the Washington Post, did an analysis of the secretary's statement. They, again, interviewed the researchers as well as other resources and did their Pinocchio test, which gave the secretary 4 Pinocchios for her comments. And Mr. Chairman, I'd like to enter that story into the record. And again, the notion that we all want schools to reopen, but let's really get a shared baseline of science.
Without objection, so ordered.
And not cherry pick in terms of studies that, again, I think just create more confusion and misunderstanding than really a shared baseline in terms of how we solve this problem. With that, I yield back.
Thank you, Mr. Courtney. Ms. Bonamici. Ms. Bonamici.
Thank you, Mr.
Okay.
Yes, I'm here. Can you hear me?
Yes.
Yeah, thank you. Thank you, Mr. Chairman, and to all our witnesses today. This is such an important conversation. I have had so many discussions with parents, students, teachers, school counselors, psychologists about their struggles over the last several months with distance learning, and we know how important it is to reopen schools. We know that. But we also know that the decision to reopen has to be based on science, and it has to make the health and safety of our students and our teachers and our staff and families the top priority. I just want to follow up on a question that one of my colleagues made, the suggestion that the flu kills more students than COVID. I did just read 2 days ago there was a 9-month-old in Minnesota who died of COVID. But Dr. O'Leary, could you respond to that the flu kills more students than COVID, but we didn't close schools? Why is it different?
Yeah, I think so. There's some background noise, but I think influenza is essentially a severe illness in children, and we do see roughly 100 deaths every year in the U.S. among children from influenza. But I also want to point out we're still learning every day about COVID-19 and its impacts on children. And any of us that work in children's hospitals have taken care of very sick children, and unfortunately, many of us have taken children with COVID-19 who have died. So to minimize the risk of COVID-19, I think is a mistake. We need to put it in context.
Absolutely.
It's not that kids don't get sick.
Thank you. I appreciate that. And I've been very concerned. We haven't had a national strategy to curb the virus. We've had rhetoric about forcing schools to open and their funding threatened, which is completely inappropriate. No school should be threatened into reopening before it is safe for them to do so. And it does vary by district and by across the country. So when schools can safely reopen, they need our help. Our public schools and districts, they need funding to make sure they can equitably serve students and keep everybody in the school building safe. And I know the HEROES Act does make a robust investment of $58 billion in K-12 schools. I hope the Senate will pass that. We need to make sure that our schools can open safely. And Dr. O'Leary, another question. The reopening guidance from the American Academy of Pediatrics makes clear that schools must anticipate and address a wide range of mental health needs for both students and staff as they prepare to open. So what mental health supports will students and staff need as they return to school? And what does the Academy recommend to prepare teachers to address the mental health needs of their students?
Yeah, that's a very important question. So, we already are vastly underfunded for mental health support across the country. Right. There's a shortage of mental health providers. Access is a real problem. And I think schools should be planning right now. I know a lot of them already are for how to handle that. They're working within their own communities to work with behavioral health specialists, child psychologists, child psychiatrists, to meet the needs of those students. But it is a real problem. It's an ongoing problem that absolutely did not start with the COVID-19 pandemic, and I think absolutely needs to be addressed.
It's been exacerbated, of course. Dr. Hinojosa, how have schools and districts meaningfully engaged with families to learn about what went right and what went wrong with distance learning? And how are school systems involving families in planning for the next school year to make sure that reopening plans will incorporate their feedback, Dr. Hinojosa?
Yes, ma'am. We definitely survey our parents. We communicate with them. We ask them to contact our teachers directly to give us, and they've been pretty honest with us about what worked and what didn't work. But I also want to elaborate that we hired 57 mental health specialists that we are bringing back to our schools, because we know when our students do come back, we're going to need support, and our teachers and counselors may not be ready to do that support. But that's a big fiscal note on our local district. We know it's important, and we've hired 57 new mental health specialist in Dallas ISD.
Well, thank you so much. Before I yield back, I just want to follow up on the concerns raised by both Chairman Scott and Mr. Morelli about testing of students. And with apologies to anyone who's eating lunch, I know there has been very promising work done on wastewater testing as an early warning system. And I don't know if Dr. O'Leary, you're familiar with that testing, but I think we need to look at all ways to make sure that we're making sure that our school buildings are safe for our students and the adults who work in them and for families. It's just something to keep in mind. Dr. O'Leary, are you aware of the work that's being done on wastewater testing as early detection?
Yes, that's one of many important strategies to help control the pandemic.
Thank you.
Thank you. My time has expired. I yield back. Thank you, Mr. Chairman.
Thank you. Mr. Norcross. Mr. Norcross, once. All right, Ms. Macbeth. Ms. Underwood, I can see you.
Thank you, Mr. Chairman. I appreciate the time today and your indulgence in allowing me to participate in this committee's proceedings. Local school administrators in my district and across the country are weighing incredibly difficult decisions. The educational needs of students, the concerns of parents, and above all, the risks to the health and ultimately the lives of students and staff. In my outreach to schools in my district, the number one concern that I hear is funding, and I'll continue to fight until the necessary funding we need and that was passed by the House in the HEROES Act 2 months ago reaches our schools that are so desperately needing those resources. I'm so disappointed that we're not able to hear today from the administration officials who are leading the public health response to reopening schools. But I'm very grateful to the witnesses who are here, and of course to our educators across the country who are working so hard to keep our kids safe and learning. Decisions about what school will look like in the fall should be guided by public health experts, and those experts must be allowed to make recommendations based on the best data and science and not pressure from this administration. Dr. O'Leary, as a pediatrician with kids' health and development in mind, what should CDC be relying on when developing guidance for schools? And why is it important that schools have clear guidance from public health experts?
Yeah, thank you. I agree with everything you just said. It does need to be made in conjunction with local and state public health. CDC, I work in various aspects with a lot of folks at CDC. I know they're working very hard right now working on this guidance. And they are working with state health departments, local health departments, as well as, physicians, et cetera, to try and develop this guidance. And I think they also recognize, though, that these decisions are best made at the local level.
Mr. Chairman, at this time, I'd like to ask for unanimous consent to enter written testimony from Lori Combe, who's the president of the National Association of School Nurses, into the record.
Without objection, so ordered.
According to this testimony, less than 40% of schools have a full-time nurse on staff, and a quarter of schools have no nurse at all. Dr. O'Leary, school nurses are critical in ensuring the health of our kids in normal times. Can you tell us more about why it's so important to have a healthcare professional like a nurse on staff for schools during a pandemic?
Yeah, school nurses do an amazing job of improving the health of students within the schools across the board. There have been a number of studies showing the positive outcomes of having a school nurse within the schools. And so in the schools where there is a full-time school nurse, in general, children have better health outcomes than where there is none. So I absolutely support fully funding school nurses within our schools.
And the school nurse is connected in with that local public health infrastructure, right? So if there's something going on in that school building, that school nurse can help flag and bring the attention into that school building, help the students, help the teachers, help the staff, help the families. Yep. I've heard from teachers in my district who are at higher risk for complications from COVID-19 due to their age or health status. They want to be back with their students, but are deeply worried that this would put their health at risk. 1 in 3 teachers in this country is over the age of 50. Dr. O'Leary, what precautions do we need to be considering to protect the health of older or medically vulnerable teachers and staff?
Yeah, I mean, first let me say, I think as a pediatrician, we choose to devote our careers to the lives of children. Teachers are no different. They are devoting their careers. And so I think we need to support our teachers. And right now, we need to do everything we can to make sure that they're safe when they're able to return to school. And so I think increasing funding to be able to help them do that is going to be crucial to successfully reopen schools safely.
Yep, funding in particular for PPE. Despite repeated calls from Congress to do so, this administration has not invoked the full power of the Defense Production Act to meet the shortages of PPE, shortages that will get worse if schools open. And in a Homeland Security committee hearing that I participated in yesterday, FEMA Administrator Pete Gaynor said the administration has no plans to invoke it to provide schools with face masks. And so we know that school districts are often very worried on how they're going to pay for their PPE and other necessary supplies for the entirety of the school year. We need to help relieve them of that burden. The administration has all the authorities at their disposal to do so. And, we are going to continue to call for the full implementation of that Defense Production Act.
Thank you very much.
Again to our witnesses for being here, and I yield back.
Thank you. Mr. Levin, he was here earlier. All right. Ms. Stevens, good trouble. Thank you. Your 5 minutes.
Thank you. Thank you, Mr. Chairman, for having me at this hearing, and thank you to our witnesses. It's certainly been an honor to hear the exchange back and forth, particularly as we move closer to the start of the school year, and we're all looking for certainty. And if we recall, when this pandemic was declared by the World Health Organization, they projected a year to a year and a half. And so here we are in sort of the middle of it, and it's uncertain, it's trying, and it's safe to say we all want it to be over. We all want to get back. We want to get back to school safely. I have been on the phone with my school administrators, our superintendents, our educators, our parents, around the clock since the first time school was canceled. It was supposed to be 2 weeks, and that was the rest of the school year. We honored and we recognized the class of 2020, these incredible seniors, and we look to the classes that are coming up, and we look to those who were juniors and sophomores and had to interrupt their sports season, wondering if they're going to get that letter. Our students of all abilities who need that IEP. The White House just the other day said, we're going to have to learn to live with this. And I know we've been getting asked some scientific questions here that are being asked of you that really shouldn't be being asked of you, to our incredible witnesses who do have PhDs and great backgrounds, and we know you, like me, like to listen to the scientists. All right. We want the answers. We're in the race for the information, but yet the White House said we've got to learn to live with this. And it dawned on me, Mr. Chair, as we've been hearing today the questions and answers about what has been asked of our educators across this country, our public schools for so long. Can you accept the unacceptable? Can you accept unfunded mandates? Can you accept the threat of gun violence in your schools? I think it's fair to say that the American public is tired of accepting the unacceptable. And we're here today as a legislative body to legislate, to partner, to join forces with you. I heard Mr. Kelly talk about that the CARES Act funding in Pennsylvania hasn't all been utilized. In Michigan, we've utilized our CARES Act funding. We struck a deal with our state capital for school funding for this year. But we're moving into fiscal year 2021. And I just this morning, before 9 a.m., was on with the head of the Tri-County Alliance for Oakland County, Wayne County, and Macomb. And I said, okay, so we struck the deal. And how you feeling? I check in with him all the time. I call him before I know he's really beginning his workday. And he said, yeah, we've struck the deal, but we still have the $750 per pupil budget shortfall in Michigan. We want to reopen safely. We want to get you to your goals, and I want to hear what you need. 5 minutes is not enough. But Dr. Hinojosa, I'd love to hear from you for a minute about what the primary concerns of our principals are and how we can best serve you and meet your needs. Thank you, sir.
Yes, well, our principal's primary concern is how do we manage the inevitable of making sure the teachers have all the tools that they need to deliver the best quality instruction for the students in a safe environment. And that's their biggest concern. And they want to. We've missed our kids since March. But unless we have a way to deliver that instruction safely, that's probably their biggest concern. And it's going to take resources to make that happen.
Resources. I applaud you for saying that. We recognize that. And we do also agree that we need flexibility. We need to empower, support, and understand your needs. And we want to continue this dialogue going forward. You're all heroes for coming in today and participating in this hearing, answering our questions, and we look forward to supporting you going forward. Thank you, Mr. Chair.
Thank you, Ms. Stevens. Ms. Lee? Ms. Lee?
Hi there. Sorry about that.
I thought so.
Had to unmute.
Yeah, 5 minutes.
Thank you. Thank you, Mr. Chairman, and I want to thank all of our witnesses today. I've sat here and listened today about the back and forth that if you want to open up schools safely, clearly you don't value in-person learning. Let's be clear. We totally agree and honor and respect and need to have students in the classroom learning one-on-one or with a teacher. That is the ultimate goal, but we also need to do it in a way where we do not needlessly risk lives. And Dr. Schwinn, I applaud your commitment to opening schools. I find it a little odd that you're not acknowledging the necessity of federal support to be able to do so. I represent the state of Nevada. We've seen a $1.2 billion shortfall, likely cutting over $156 million in K-12 funding. And so we know that whatever option that we're looking at, and a lot of them aren't great options, that we need, will require additional resources. And honestly, to me, it requires extensive testing. And I want to point out that in Tennessee, you are one of 9 states that has more than double the testing needed. That's been estimated by 3 public health organizations that would be needed to control your outbreak. And the fact that Tennessee basically fronted the cost of this test so that anyone who wanted it could get it. Tennessee officials now acknowledge that they are hoping and they're banking on the federal government paying for those tests. So to me, the lack of testing in this country is number one, why we have rampant unemployment, but number 2, why we are faced with this awful decision on how we reopen schools, whether we treat our students and our teachers like guinea pigs by rushing to open our schools without proper resources, or we keep trying to do remote learning, which we know does not do our families and our students the justice that we deserve. Dr. Hinojosa, I wanted to ask you, you're in a predicament quite like the one we're in Nevada, where Dallas is facing an issue of nearly $33 million in lost revenue, which is certainly going to impact your schools. Can you tell Congress and tell us how we can best address these revenue shortfalls and, how we can best help you in your ability to reopen in the fall?
Yes, for us to be open, for our biggest ask right now is to make sure that we have broadband connectivity and devices so that we can connect with our families. And also, we do have the PPE, so we're good on that kind of information, but we need a lot more support going forward with how our special needs students get supporting. And Title I is so critical to us. 92% of our students are economically disadvantaged. And also the big funding that comes from the Department of Agriculture for feeding our students. We feed all of our students 2 meals a day. And it is just extremely important that those opportunities continue for the long term. And then also the state took a lot of our money through the CARES Act to supplant the revenue that we get. We understand why they did it, because they have significant shortfalls. So they did that to shore up this year. But that's only this year. Going forward, there's going to be huge deficits in state budgets. And so it is a domino effect that will trickle down to every community in the state of Texas if nothing is done about it.
Have you estimated what you plan to receive from the HEROES Act, and what's the delta between what you would estimate that you're receiving and what you actually think you need to open safely?
No, there's a lot of nuance in that, because under the CARES Act, we thought we were going to get 61 million. We actually got 31 million. But from the HEROES Act, we haven't fully analyzed that. And there are several other bills in front of Congress that could help us with connectivity. So no, we haven't done that analysis yet, but it would be significantly helpful for everybody in Texas.
And then finally, I think we're running out of time here. Can you just walk us through what you've gone through with your local public health officials to talk about the public safety with respect to your reopening plans?
Absolutely. We're in constant contact with our local health officials about what is they expect from us, what we need to do to make sure that we have everybody safe, distancing, masks, shields, buses, entryways. Every item we've discussed has been considered with our local health officials.
Thank you. Thank you very much.
Thank you. I yield.
I now recognize Ms. Shalala for 5 minutes, please. Ms. Shalala?
Thank you. Thank you, Mr. Chairman. I apologize. I had to preside on the floor, so I just got back. I'd like to ask Dr. O'Leary a question. Dr. O'Leary, the Florida Education Commissioner, Richard Cochran, recently issued an emergency order that aligns with the demands of the Trump administration, requiring all schools to reopen full-time for all 5 days of the week. They're going to be mandated to meet minimum number of instructional hours for students. This past Monday, Florida's largest teachers union filed a lawsuit seeking to block the return to in-person classes because we have community spread in Florida. The virus is in fact out of control. And we know without a safe environment to learn and grow, children risk developmental delays. In your view, what are the risks for students from increased exposure with their peers, especially in a state like Florida, which remains a hotspot of the virus? Is it the right approach to have students come to school every day of the week? And what alternatives would you recommend?
Yeah, look, we're all on the same page. Thank you for that question. We're all on the same page that we want kids in school, but we have to do it safely. And where the virus is surging as it is currently in Florida, we have to be really cognizant of those issues. And, one, it's not safe. Students are going to get sick, teachers are going to get sick, staff is going to get sick. So that's number one. Number two, it's not practical. If you open schools when the virus is circulating widely in the community, it is inevitable that it's going to get into those schools and you will just have to shut them down immediately. And that is, we're all dealing with sort of whiplash from this whole thing. And imagine students going into school and having to go right back home the following week. And that's what's going to happen if you open schools in a place where the virus is widely circulating. It's inevitable.
Thank you. And if I might ask the superintendent a question, just a quick question. About minority and low-income students, clearly, and also disabled students, is there another strategy, perhaps tutors, that we should focus on to make sure that students who in underserved areas actually are able to keep up with their work if we have to go online for the full fall. If you had the resources, what would you do in terms of helping those students to catch up in addition to their classroom work?
Yes, we do have some assessments that tell us which students are the furthest behind and have the least contact. What I worry about is that a lot of these nonprofits that help us, like Reading Partners and tutors, they're also not getting donations from other people that help, foundations that help support them, because they're short on dollars. So it's a double whammy on our partners that need to help us with the wraparound services that our students need to have tutoring and reinforcement. So I think an influx of resources would help not only us, but them to be able to provide the quality nonprofit services that they help us to support and tutor our students. It would be vitally important.
Thank you. I yield back.
Thank you, Ms. Shalala. At this time, Ms. McBath has agreed to let Ms. Wild. Ms. Wild, you have 5 minutes.
Thank you, Mr. Chair, and thank you to my colleague, Ms. McBath, for her accommodation. My question is for Ms. Leslie Boggs. Ms. Boggs, when my children, who are now in their 20s, were in school, their dad and I panicked whenever we had to accommodate a single snow or sick day into our work schedule. So I have great sympathy for parents now as they try to figure out how they are going to manage their schedules, not to mention being worried about their children's health. And so many of the discussions we've been hearing around school reopening have focused on the perspectives of the administrators, the teachers, and political leaders, quite frankly. I think it's vital that we engage parents and families in the conversation on how to best and most safely reopen the schools, because it's going to affect parents and families just as much as it affects students and school staff. And based on the conversations I've had with the parents in my district, there is a wide range of opinion about how schools should operate this fall. So my question to you as president of the National Parent-Teacher Association is, do you think parents and PTAs have been included enough in the local and national conversations about ways to safely reopen the schools? And could you just comment on the benefits of incorporating the parents' opinions and insight when creating these school reopening plans?
Thank you for the question. It's interesting to see across our nation the effect whenever parents and educators become true partners in our education system. I'm hearing from several states that parents have been meaningfully involved in the conversation for reopening schools, but I've also heard that there are some school districts that are not including parents in the conversation and students. So I think in order for us to be completely, can you hear me?
We can hear you. We can hear you.
Yes, we can hear you.
Okay, there's something came up on mine that said I'd been muted. Okay, so whenever I see that parents are not included in the conversation, that's when you're going to see schools struggle with reopening, because they're not listening to the critical issues parents are concerned about. They do want to be back in school, and we know that for sure, but they are concerned about the safety and the reopening of those schools and the ability for them to do it appropriately. So I think that's why you have to see that conversation be there. I've seen districts, even my own district here in ECISD, this administration does a Facebook Live every week, takes questions from parents. They've had town halls with parents to see what they can do to help effectively reopening. The concerns is if we don't reopen schools, again, is that homework gap or learning gap. Because what you're seeing in districts that are low-income districts is that they are really hurting more. And what we've seen is there's really populations that bear their burden, right? There are 37% of rural students and 21% of urban students lack home internet access, 35% of Native American students, 30% of Black students, and 26% of Latino students have inadequate internet access at home compared to only 18% of white students. We've got a disparity that we've got to be worried about. When children come back to school, they're going to be significantly needier than they've ever been in the past. And this is probably the biggest hurdle I think our education system will have to overcome is really assessing those needs for each student. And they're very different depending on where you are.
Well, thank you for that very thoughtful answer. I'm a big believer that we need to be establishing commissions or committees that consist of teachers, parents, other educators, physicians, both pediatricians and infectious disease, and that we really need to get the political officials out of the discussion and yield to the sentiments of the people who are true stakeholders and who really know what they're talking about when it comes to this, and you're clearly one of them. Thank you so very much for your responses. I yield back.
Thank you very much. And now I recognize Ms. Macbeth for 5 minutes, please.
Thank you, Chairman Sablon, for holding this hearing today, and thank you to all of our witnesses that have taken the time to really enlighten us as to what's truly happening with the public school system and our children. And I think that we can all agree that the best place for our children to truly be educated is in the classroom. I don't think anyone here is denying that at all. But our current pandemic prevents us from allowing that to happen safely. And I will say just very briefly, I was a woman who chose to homeschool her child, 4th through 8th grades. And I know that that is not something that each and every family is able to do, but I understand now that I think parents are feeling that they're in a sense of homeschooling, even with virtual schooling, and that adds a lot of additional stresses because of the COVID-19. So after the last few weeks, I've actually had conversations within my own district with my teachers and my school board members. And we were trying to decipher, and I wanted to hear from them, what is the best pathway forward going forward to reopen our schools? These conversations, they confirmed my deepest fears. I felt in my gut that there was trouble and that our teachers and our superintendents were really troubled by how they were going to best be able to appropriate funding and resources and tools to make sure that our children have the global education that they deserve. And our teachers, what I found out, basically are afraid of infecting their students with COVID-19, but also they are afraid that their students might also inadvertently affect them too. They said to me there was clearly a lack of uniform guidelines, and this is when I represent the 6th Congressional District of Georgia, but there was a lack of clear guideline and guidance from our administration as to how our students and our teachers would be protected to return to the physical classroom. So I know that we're here today because of that lack of leadership. And if the administration had acted earlier to prevent the spread of COVID-19, I really believe we would not be in this predicament at this time. The House, we have passed the HEROES Act. We actually passed that 2 months ago. And yet we're still waiting today. We're still waiting on the Senate to take action on the HEROES Act. And the HEROES Act, we know, truly appropriates the funding and the resources and the tools to save lives. In each of my meetings with my local school officials, they all expressed the need for more funding from Congress for PPE and also school infrastructure and hiring more mental health professionals in the school, because that is definitely lacking, and the mental health of our students is very, very critical at this time. The HEROES Act does provide for increased funding for mental health services, and it also gives the resources necessary to stop the spread of this very devastating disease. Ms. Boggs, if you would please answer my question. You mentioned the results of the Virginia PTA parent survey in your testimony, which I have read. As we all know, the pandemic might be taking a toll, most specifically on the mental health of many, many of our students. Did the responses align to those concerns, the responses from that survey?
I would say yes. I think they align with the concerns that you heard and saw within the report that we gave. Parents are just overall just concerned, but they want their children back in school, but they do understand that more than likely we will see different options for parents. The concern that I have as leader of this association is ensuring that everyone has options, and that parents are not putting themselves in a no-win situation. So we know that distance learning is not the best option, but if our schools aren't safe, then we're not giving them great options, are we? And I think that's where I find your earlier comment on leadership during this crisis, leaders will be defined by what happens during this crisis. We've seen the House do the right thing. I think the Senate needs to understand that leadership needs to happen, and our nation is waiting, and our parents are watching. So I hope this answers your question.
It does. Thank you very much. And Mr. Hinojosa, can you please discuss how the Dallas Independent School District's plan to reopen addresses the needs of marginalized students, including students that have disabilities? I'm very concerned about that. And we know that those students, those demographics of students, are disproportionately impacted by school closures.
Yeah, that's one of our biggest concerns. We have a lot of robust plans for our traditional students, but our students with special needs, by definition, have an individual plan that has to be adjusted. And many of the parents now carrying the burden of doing that at home with our trained professionals are the ones that need to do it. So we also, though, need to be concerned about their safety. And those teachers have to get very close in proximity to the students under certain conditions. And so we are concerned about that, and we need resources to make it happen.
Thank you.
Thank you so much for your answers. I yield back balance my time.
Thank you very much. At this time, I'd like to remind my colleagues that pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing. So by close of business on August 6, 2020, and preferably in Microsoft Word format. The materials submitted must address the subject matter of the hearing. Only a member of the subcommittee or an invited witness may submit materials for inclusion in the hearing record, and documents are limited to 50 pages each. Documents longer than 50 pages will be incorporated into the record via an internet link that you must provide to the committee clerk within the required time frame. But please recognize that years from now, that link may no longer work. Pursuant to House Resolution 965 and the accompanying regulations, items for the record should be submitted electronically by emailing submissions to edenlabor.hearings@mail.house.gov. Member offices are encouraged to submit materials to the inbox before the hearing or during the hearing at the time the member makes the request. The record will remain open for 14 days per committee practice for additional submissions after the hearing. Without objection, I would like to enter the following statement and records into the record. A statement from Dr. Bobby Cruz, Director of Instructional Technology, Commonwealth of the Northern Mariana Islands Public School Record System, COVID-19 planning considerations, guidance for school reentry by the Academy of American Pediatricians, a plan to safely reopen America's schools and communities by the American Federation of Teachers, all hands on deck, initial guidance regarding reopening schools by the NEA, and guiding principles and action steps for reopening schools by the AASA. Witness questions for the hearing record. I want to thank our witnesses for their participation today. Members of the subcommittee may have some additional questions for you, and we ask the witnesses to please respond to those questions in writing. The hearing record will be held open for 14 days in order to receive those responses. And I remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. I'd now like to recognize the distinguished ranking member for his closing statement.
Thank you, Mr. Chairman, and I want to thank everyone for taking time today to provide testimony about this important topic of safely reopening our schools this fall. I want to thank all of our witnesses for their input, and it's much appreciated. Dr. Swin, a special thanks to you. The coronavirus pandemic has tested our nation's public schools in a way we've not seen in generations. We know that Americans can turn this challenge into something positive for students by further enhancing how we educate our students. Quite frankly, we cannot fail a generation of school students. Children learn and thrive in school. Students deserve the option to go back to school with instruction, supports, services, and all this provided in person. And we all need to work together to focus on how to make it happen safely. Likewise, teachers and staff deserve thoughtful, thorough planning that protects their health and safety while at school. We've touched on the many reasons that the ability to safely return to school is so important for our students and their families. Many students rely on schools for meals, for the support of counselors, coaches, school nurses, and the many other trusted adults that make up our school community. Families' economic security has been negatively impacted by COVID-19 related to school closures. We must remember that in the best of cases this spring, families were adapting to remote learning in their homes and making do with virtual connections to classmates and educators. But in many scenarios, families struggled without critical resources for their children. Now more than ever, we need to work together to help all children get the education they need to thrive. We have guidance from the CDC, the AAP, and other experts outlining the considerations for returning to schools and the steps we need to take to do it safely. States like Tennessee and Georgia are setting great examples of the resilience and fortitude it takes to find solutions in the complex conditions we're facing today, and will continue to face this in the fall and in the future. No one takes the decision to reopen schools for students this fall lightly. It is with great consideration coupled with determination to do what's best for our nation's students. Every student should be afforded the option for high-quality instruction this fall. I want to thank again our witnesses for bringing thoughtful testimony before us today, and I look forward to working with my colleagues and educators to ensure our students are provided opportunities to be successful this fall and beyond. And Mr. Chair, I yield back.
Thank you very much, Mr. Allen. I also want to thank you again, all the witnesses, for joining us and providing your expertise. I want to thank the members also for taking part in today's hearing. And today's hearing confirmed that what families, school staff, education leaders, and public health experts across the country have been telling us for months. Schools need immediate and significant support to confront the unprecedented challenges of providing students with safe and high-quality education during this pandemic. President Trump and Secretary DeVos should heed that warning and join Democrats in delivering the $200 billion in relief that we have passed to help schools safely reopen for in-person instruction. But instead, this administration is leaving school districts to fend for themselves and threatening to strip away, without any legal authority, the very resources that schools need to ensure the safety of students and school staff. In short, this administration is abandoning the health needs of our school communities at a time when the U.S. has surpassed 4 million known COVID-19 infections, and they're blaming school districts for not doing enough to reopen. I'll reiterate again, each one of us wants to reopen our schools as soon as possible so that we can get our children back into classrooms and reopen our economy. But we also have a responsibility to care for the health and safety for our students, families, school staff, and communities. And that must always be our first and foremost priority. I look forward to working with you and all my colleagues to provide our schools with the resources they need to safely reopen classrooms, welcome students back to in-person instruction, and help our economy recover from the pandemic. Thank you. If there is no further business, without objection, this committee stands adjourned.
Thank you both. For sure. Thank you.